So I would like to now introduce Pearl Sithole from the University of the Free State in South Africa. She will speak on family decisions on health and economic survival, a struggle for inclusive mercy in Southern Africa. Thank you very much, Professor Sithole.
Thank you very much, Chair, and good morning, colleagues. I also want to start with sincere gratitude to have been afforded this opportunity of exposure to such depth of analysis on a subject that is so concerning to all of us. And also just because the spirit of this gathering is both about the depth of analysis and the seeking of solutions. So thank you very much for this. I am going to present a paper that is actually conceptual, much to the deception of the title. And I'm doing this for two reasons. The first one is that there is a concern that I have held for a while around framing the relationships within the globe and finding out why certain areas of the globe, the regions of the globe, are trapped into some kind of ditch that is constantly being worked on constantly by other regions. And so they are more recipients of help than active in terms of being seen out there as well. They can be active for their condition, but in terms of being seen out there, there is a concern around that. And secondly, I also am presenting this paper because I'm hoping to learn from reactions whether there is anything like we are seeing, particularly in South Africa, where we have a phenomenon called fallism, where the youth, they started long before COVID to start wanting things to fall. You will know, because the spillover went all the way to Europe at some point. They wanted roads to fall. They want fees to fall. And what we've seen is that during the COVID pandemic, when we were all, then there was a lot of empathy and sympathy around this problem. We also saw the fallism happening even digitally. And so if you look at the youth, and we are now moving away from primary schools to universities, and you look at how they are using all of the platforms to continuously drum the idea of fallism, you begin to wonder what is unique about this environment that makes the youth so uncomfortable. And what is it perhaps that we as the generation senior have done or not done to actually cause this discomfort of the youth? And so this paper, colleagues, is going to do two things very quickly because of time. The first one is to suggest that there's something in the methodology, particularly the social science methodology, that is not going well in terms of, and I think there were glimpses of this even in yesterday's discussions, in terms of how social science mimics other sciences by inquiring and stopping at discovery. And I'm not saying that we are all doing this, but I'm saying that the scope of venturing into intertwining intervention is something that is much more expective of a social science, and it is not being done optimally. And so social science does not enmesh discovery with exact diagnosis and championing all scientific disciplines, including those that are not social science, to carve relevant solutions. And I was really touched when I heard Jeffrey Sachs keeps drumming this idea that you can do something, because I think that is where we are all diagnostic to a point, and not even in terms of the exactness of locations and context, but we're not necessarily interweaving the intervention. So what we saw COVID do, and I observe this even as I sit in boards and ethical review boards that look at proposals for research. What COVID did was to say that let us revise what we are doing and be conscious of the fact that both the social actor and the analysts are actually in the space now where we need to be concerned about understanding, about diagnosis, and about intervention, all the way to ethical issues involved, even as we do research. So I think that I need to emphasize this observation, because it also has a bearing on on how I see these other regions being entrapped into some kind of framework of being operated on without necessarily being allowed to interact with issues. And you will see possibly how that has bearing with the hesitation on the vaccine, for example. And so I think in 2011 already, I had started to instigate the idea of intellectual choreography. That is how I phrased it. And in some writing, I call it intellectual mapping, so that the social science is different in terms of its concern about the impact of the analysis, as well as the continuous need to forge intervention. And that is not exactly the same as social, as action research, but I'm not going to dwell too much on the methodology issue at the moment and hurry to talk about how it will have a bearing on the African family and the youth. Already, even yesterday, we had spoken a little bit about issues of individualistic societies and communal societies. And where I am headed is to suggest that actually we've evolved from that. The categorization framework that we have as social scientists is actually not evolving with the issues and times. We are now into instrumentalist societies. Someone spoke about calculated thinking yesterday. We are in a kind of instrumentalist societies that relate on the basis of calculation, generism, and formulation of straitjacketing policies that people are constantly suffocating from and are wanting some kind of being themselves within. And this has bearing on what one is observing in Southern Africa. And I'm saying this based on the literature that I've read, and comparing it with the, especially newspaper, capturing what we have been experiencing in Southern Africa, in South Africa in particular, that what we are seeing are elements of an already suffocating and alienated family that we have in Africa, over which COVID came, and when COVID came, issues of agility, issues of wanting to do things immediately for ourselves started to be on the radar screen. And so in Africa, if we admit that there is a leaning towards a communal kind of family, then we have to recognize that generally the most embracive way, with all of the nuances that we can suggest, is a relationship between family or socialization and children, is that it takes a village to raise a child. And if that is what characterizes Southern African families generally, what we saw during COVID was amazing, because in the first instance, when we were all ordered to stay at home and all of the lockdowns happened during that time, and many of these things also came out yesterday, you could see that actually you're having withdrawal symptoms in children, you having a lack of understanding of the future. There was a generalized anxiety amongst parents, but that was also exacerbated by the fact that all of the suggested interventions of forging a life forward were happening in a context where there is inequality and there is a digital divide. There were issues of food insecurity, and one can go and describe that. It's sufficiently described in literature. There was increased gender-based violence, and by now everyone knows that almost South Africa is almost the capital of gender-based violence, and it continued. It's getting gruesome by the year. You had a situation of deep life-changing traumas happening to people because of regulation. People couldn't even go and see their relatives in hospitals because of COVID restrictions. And therefore, even the nature of death, put aside that death itself is harmful, even the manner of death and being pulled away from relatives was traumatic. There was intensification of regulation to extreme levels that resurrected almost the apartheid period, where people have had to have travel permits. They had to have travel permits to enter institutions. You had, before all of this, a very dubious relationship between public health institutions and the citizenry. And so when you actually come and then impose a single method into the whole issue and say, thou shalt vaccinate, and in fact, we are threatening, and some of us are going to enforce vaccination mandates in a society that is actually suspicious of the way that the public institutions treat the common citizen. It became really complicated, and it still is now in South Africa especially. And so by the time solutions came, they came with a civilizing approach that actually worsened the relationships between public administration and the citizen, because they never took into account that it is a citizen that feels, that thinks, that has perceptions, and more than anything, the hurried and by the deadline solution complicated matters, even if it is scientifically justified. In other words, the social elements of executing scientifically valid interventions was not actually considered. And there's also a whole range of other personal issues pertaining to cultural rights that were suspended, and the whole thing was complicated. I'm just summarizing a little bit these, just and being mindful of time, just because I want to get into a space where I actually describe the complication of the interventions as, and at least one element of it, as being its benchmark of against the middle class. All interventions are complicated in a context such as the African setting because of the middle class benchmark that they have. So you are finding a situation where when government started to say, okay, other than locking you all down and the hard lockdowns, we are going to actively do certain things. We have procedures around isolation, we have procedures around quarantine, and we have procedures around contact tracing, and we are willing to fund and enable you in all of those things. We will even have you download an app to conscientize you of who has COVID around you, that COVID is near you, because everyone who would have been tested would have had their numbers somewhere in the system. when vaccination came, you will have electronic registration. All of them, these interventions, actually assumed the average middle class. No one translated what isolation means in that one room informal settlement. No one translated what it means to say that you're going to do contact tracing in these congested texts that people are using. No one actually translated what quarantine and isolation means. Please excuse me, someone is doing the grass and it's making a noise. Sorry about that, joys of working from home. No one translated all of these things for the common, the average citizen of the countries. More than that, what happened is that when you then get into a space where you give up on us understanding each other within our own context in this rigid regulation, and you listen to the global social justice moves, which are quite appreciated. They themselves were trapped into the middle class kind of assistance. Thou shalt not discriminate when you distribute vaccines to discriminate African countries. Well, in the first place, African countries are grumpy about the fact that no amount of own effort to do anything is recognized out there. In fact, anything that even raises its hand or head is quashed and never to be known in terms of where it happened before. There were elements of research in Lesotho, elements of research in South Africa that were intermixing the indigenous medicine with laboratory work. No one ever followed on that. So when the sympathy only comes as a form of thou shalt not discriminate African countries with what we import and impose on them, it actually exacerbates the fear, and it actually exacerbates even conspiracy theories, because there is no engagement with the African as the thinker. Do not donate only insofar as you are spared by expiry dates. Afford people psychological counseling, because some of them are hesitant because they are scared of needles. All of these things do not bode well, because the African is not engaged in all of it. It is a pouring approach to the African kind of thing. And I've covered all of the things about the suspicion that already existed, the trauma of regulation, even historically. In an apartheid South Africa, for example, fathers were stripped naked and scrutinized for syphilis before they were given a permit to do something. Today, everyone is supposed to either be vaccinated in many other institutions, or submit medical records to some screening committee before being given an exemption. It just resurrects certain kind of socio-political patronizing elements that should have been thought of before a medical health, pure health kind of approach was imposed on communities. I just want to therefore say, in all of the middle class centeredness of the socio-global justice that is apparent, the issue of herd immunity has not been explained in a way that sits well with context of various countries, and especially I can speak confidently about Southern Africa. And that element, which is crucial in curbing COVID, should have been primary and integrated in all of these approaches. And so the sum total implication of all that I have described is that the African family was reduced into an operated on unit that contributed very little to the approach of COVID-19. and could not even have a voice to be considered. Secondly, the issue was reflected in institutional reduction of people into statistics for regulation and management, and as well as the subsequent bullying approach towards vaccination. And then thirdly, global empathy played straight into the hands of that science capitalism, in that it was silent about lack of indigenous expression to management of COVID. It marketed vaccines only, and inadvertently silenced the local voice in the bid to lobby for vaccination equity. So all of this over an alienated consciousness of an African family created a situation in the end that endorses the bottom status of Africa in the ladder of conceptual and professional sovereignty. And as I conclude, Chair, I want to say that the paper goes on to actually talk about the practical decisions of the family in this plethora of things, and which package to choose and which to ignore in terms of survival, both economically and in terms of health. But it also emphasizes that the decision of an African child about formulating themselves as a thinker and a potential professional in the space of global consciousness is limited to what they see every day, the mastery of mimicry, which we, as even the scientists in universities, are doing in this space when we pull our suitcases and go to conferences elsewhere without necessarily being able. We were shown up during the pandemic, because all we are ever able to do is to say what the others are producing is fine, dear community. And that is the context within which holism is happening. That is the kind of youth we have brewed in Africa. And I shudder to say that it is coming back to bite us because of the over-exerted formalistic environment that we are in. Instead of a child being raised by the community, what we've seen in our context is that it has taken a global village to silence the African. Thank you, Chair.